Hi, and welcome to Society Matters Bite-Size Briefing. My name's Lee Booth, the Trading Manager of Society Matters, and I've got the great pleasure of having our welfare expert, Adam Matthews, with us as well today. So thanks for joining us, Adam. Firstly, I hear there is some more positive change when it comes to welfare benefits and people who are terminally ill. Obviously, when people become terminally ill, it's already a very stressful time for them and the families, and the benefit system is already very complicated. So what's changing and what will be the impact of this, Adam?
Yeah, thanks, Lee. So the rulings are changing following a recent review, and there was endless campaigning from charities and families. The DWP has announced that the definition of terminal illness used within the benefit entitlement is to change. So the current definition is that the death must be reasonably expected within the next 6 months. That's going to be extended to 12 months. So this will help many families and medical professionals when it comes to proving people are terminally ill and making sure that they get paid quicker. What is always a very difficult time, not just mentally and physically, but also financially, with increased costs such as frequent visits to hospitals and taxis, for example. So ministers plan to implement the 12-month end-of-life approach across 5 DWP benefits, and that's going to begin with universal credit and employment support allowance next year, and attendance allowance, disability living allowance, and personal independence payment when parliamentary time allows for this as well. So hopefully next year as well. If you do come across someone that's claiming benefits and they are terminally ill, you should ask a medical professional to fill in what's called a DS-1500 form, so you can get the benefits paid much quicker. You may also get benefits at a higher rate or get extra money as well. So the DS-1500 form does confirm your diagnosis and your treatment plan as well. So medical professionals would include GPs, it could be hospital doctors, it could be registered nurses, so for example, Macmillan nurses or specialist nurses as well. And they should send it to the Department for Work and Pensions to support your benefit application. You can send it yourself, and the address is actually on the form. If a person is terminally ill and they've reached state pension age, they can apply for attendance allowance. You don't necessarily need to be looking after someone just to be eligible for attendance allowance. If a person is terminally ill and they're aged 16 or over and they've not yet reached state pension age, they may be entitled to universal credit and get the limited capability for work-related activity element straight away. They may also be entitled to personal dependence payment and get the enhanced rate for the daily living component straight away. Some people who have paid their national insurance contributions for the last 2 to 3 years may also be entitled to new style employment and support allowance and automatically go into the support group and get a higher rate as well. If a family has a child aged from birth to 16, they may qualify for disability living allowance for children and automatically get the higher rate for the care component if the child is terminally ill. So the benefit should be approved much quicker, in some cases up to 2 weeks. And as we know, some people would be waiting 4 months for a PIP decision as things stand at the moment, for example. I would always advise getting support from a social welfare advisor when dealing with a person or a family when someone has become terminally ill, as they may need other local support and they may be entitled to other benefits. So for example, carers allowance if they're caring for someone who is terminally ill.
That's great. That's good to know, Adam. Thanks for that information and obviously keeping us up to date. So thanks very much for your time, Adam. And our viewers, we'll see you in 2 weeks' time for our next bite-size update. Thanks very much.